All right. Good morning and welcome to our HIV prevention and education virtual summit presentation entitled Taking on the Challenge of Stigma. Today we are joined by Blake Rowley, a senior community liaison from Gilead Sciences. Before we begin, I'd like to go over a few reminders. Viewers, please make sure your mics are muted. The chat box is disabled, but you can ask questions using the Q&A box located at the bottom of your screens. Remember, this presentation is being recorded. Q&A will take place at the end of the presentation. At this time, I will turn it over to our wonderful panelist so that we can begin the presentation. Thank you.
Thank you, Kat. Greetings and salubrious salutations to everyone. Thank you for joining me as we take a little bit of time to talk about taking on the challenge of stigma. Again, my name is Blake Rowley. I'm the Senior Community Liaison with Gilead Sciences. And I'm going to go ahead and share my screen and hope that this works. You would think that after about 2 years of a pandemic, we'd have this perfect. But Kat, if you could just tell me really quickly what you see.
I see your main slide for your presentation, Taking on the Challenge of Stigma.
Perfect. Thank you so much. And we will take all questions at the end. Anything that I say, please feel free to, ask questions about that. Also, just to kind of level set, there will be some terms that you may hear, such as like queer, where I'll refer to everyone under the LGBTQ umbrella. I'll say if we're talking about Black people, words, though that sort of population is encompassing all people of the African diaspora, including our Afro-Latina folks. I will use the term Latin A instead of Latinx, generally to refer to all people of sort of Latin origin. And then if I'm speaking about women, I am talking about all women, and that is inclusive of women of trans experience. And so I'm going to jump in and feel free to, again, ask any questions at the end. So what we're going to do today is sort of first define and discuss some of the forms of stigma, its impacts on people. We'll talk a bit about stigma around sex, HIV and PrEP, a little bit about some of the actions that people take to cope with stigma, some of them which are good and some of them which may be less great for folks, but we don't want to sort of demonize how people do cope with different things, but we want to make sure that we can provide some solutions as well as some resources, particularly for folks who struggle with stigma at the intersections of sexual health, mental health, and substance use. So just to define stigma, we generally think of stigma as a mark of shame or disgrace, something that we give to people or groups of people that we deem or that society deems as unacceptable. And it generally is a result of some unfair beliefs, some historical context, and it leads people to a number of different types of prejudices, discriminations, bigotries, etc. But really it's categorized as people who are different and thus so blamed for that difference. For example, we'll talk a bit about this, people who are not thin, and we blame people who are not thin for being a different particular size, right? As if sometimes it is something that is wholly in their control. And it's a way to create in-groups and out-groups. So it really puts us versus them, right? People who are able to do one thing against people who are unable, or we restrict them from doing another. And stigma really affects all of us and affects anybody, right? Anyone who has any particular health condition, cancer, obesity, mental illnesses, and HIV. When we think about cancer, particularly things like lung cancer, it's easy to stigmatize people who are smokers for having lung cancer and that being the result of their negative activity. And so we, again, sort of create this dichotomy of in-group and out-group. People are stigmatized, obviously, for their race, ethnicity, gender, sexual orientation, some of the mutable and immutable characteristics of people that really is sort of ingrained in the world's culture at this point, around things like racism, how we treat folks of color differently, how we treat women differently, people who are non-male identified, etc. And then other behaviors we stigmatize. So people who engage in substances or sex work, whether it be for the enjoyment of it or whether it be as a means of survival. We collectively as a society, not necessarily the people on this call, but we often think of the people who engage in those things as somehow less than or engaging in immoral activities. The other thing that's interesting is you can experience stigma at more than one of these categories, right? And we call that intersectional stigma. So these are when certain stigmas are being enacted upon on multiple levels. And so if you think about a Black woman who is maybe dark skinned, is maybe experiencing stigma because of her skin tone. She may also be experiencing stigma because she's a woman. And so those two things could be converging and really creating a more harmful atmosphere for her. And so it happens in a couple of different ways. Obviously, internal stigma is stigma that people feel about themselves, and it prevents them from talking about experiences. It prevents them from seeking help. You may have heard that as felt stigma or self-stigmatization. The other type of stigma is external stigma. And so this is when people enact stigmas on other folks, whether that be real or perceived. And it really is sort of around this unjust treatment and bias towards other people. And it's, to be clear, bias exists for everybody, right? We all sort of exhibit internal and external stigmas at various points in our lives, depending on whatever it is we're struggling with. Internal stigma, just to go a little bit deeper, again, as I said, is about stigma that people experience within themselves. It leads to things like feeling shame or isolation, or in some cases, despair, which obviously leads to things like depressions and anxieties. There's a fear of being discriminated against or judged negatively. And these things, particularly as it's related to conversations around people's sexual health, prevents them from taking proactive steps about their health, right? It prevents them from doing things like getting tested. If you're struggling with your queer identity, having to go disclose that identity or the activities that sort of are surrounded with that to a medical professional or to anybody may be a bit of a challenge if you've not quite grappled with how you feel about that. The external stigma, again, as I said, is sort of this enacted stigma, and some of it is public, and these are the things that people in the community do to other people, and some of it is institutional. We have created systems and ways and through our cultures and policies at organizations, at the governmental level, that really reinforce negative attitudes about people. And so public stigma and institutional stigma, we oftentimes call structural stigma. And it's really because it's rooted in our society, right? It's rooted in our legal system. It's codified into our healthcare system. It is a way that we have physically sort of separated certain types of people from being able to engage with other types of people, and kind of called that okay. Even though we know as sort of professionals in this space, it's not okay to do that to folks. And doing this is really, really harmful to people. It can be damaging and damaging to themselves, damaging to relationships. It can negatively impact people's physical and emotional well-being. And so it leads people to do or engage in activities that, again, are sort of not the best for their health, or it leads them down roads about sort of potentially for self-harm. And so it others people, as I mentioned, and obviously leads to discrimination. Here's just a couple of the harmful effects that stigma can include. Chief among them is really a lack of understanding by family, friends, coworkers, and others. And a lot of times we like to look to our family and friends as being the safe spaces for us to be able to talk about things. And sometimes those people are not those safe spaces. Depending on how they have been reared and what they hold on to, they may stigmatize us for whatever activities it is we choose to engage in, whether that be same-sex behavior, whether that be substance use, whether that be taking something such as PrEP. And we'll talk about PrEP or pre-exposure prophylaxis a little bit later. Stigma is also harmful because it makes certain people believe that success is impossible, right? There's this idea of fatalism, particularly prevalent among Black men who have sex with men or Black queer men, is this idea that I am going to contract HIV. It's just the thing that will happen in my lifetime. And so we want to make sure that we create spaces and places for people where they don't have to necessarily feel that. Stigma creates fewer opportunities for work and school and other social activities. We tell people who are living with certain health conditions that they can't participate in certain activities just because we don't want them there. Obviously, bullying, physical violence, or harassment, these are things that, are sort of more prevalent now, at least in the media, than they maybe have been in the past. We see a lot about bullying, physical violence, and harassment. And then obviously we mentioned being treated unfairly in the healthcare system. And again, people can have these things interacting on multiple levels. You can have them because of your race, your gender, your orientation, your ability to be able to walk. When we think about how we stigmatize people who are differently abled, we want to make sure that we sort of remove those barriers within ourselves, and particularly as healthcare professionals, think about how how people are perceiving us, and how do we make sure that their healthcare interactions are as robust as possible. So this is probably my favorite thing. I'm a person who loves sex. It's kind of why I got into all of this. But it's also something that as a community, we don't really talk about a lot, and we stigmatize sex from a health perspective, but we also don't really think about sex, from a pleasure perspective. And we stigmatize the fact that people like to have sex from a pleasure perspective, right? It's one of the main reasons why we have sex outside of to create children. But it is stigmatized, sexual orientation, particularly orientations that are not heterosexual. We live in a heteronormative world. So cisgender male and cisgender female relationships are sort of the prized ideal relationships, and anything that is not that is stigmatized. Also, people who express their gender differently. This can be people who are persons of trans experience, people who are non-binary. It can be men who occasionally like to wear a skirt, and so we call those people we call those people different names, we exclude them from different things. And then STIs are one of the other things. Many people in this world would contract an STI at some point in their life. It is just part of the nature of having sex. And there are some extremely common STIs out there: syphilis, HPV, gonorrhea, chlamydia, that affect almost everybody who has had sex at some point in their life. But we continue to think about people who have had STIs or who are currently experiencing an STI as dirty or unclean. And we see that language used on some of the places where we go to meet our partners. And using language like that, again, sort of infers that the other person who is not living with an STI is clean, but that you have done something disgusting to contract that STI. And the truth of the matter is you just lived your life. And we have to get to a space where we don't think about STIs as this sort of gross thing that happens in the bed, but just as things that happen as a part of life, and that there are ways to treat them. And then obviously sexual stigma leads to people not being treated with respect, dignity, and in some situations, particularly for folks who have different expressions of their gender identity, these sexual stigmas do lead to physical violence. It has been said over and over that we continue to see alarming rates of violence against persons of trans experience increase year over year over year over year. And so when we think about how we stigmatize particularly persons of trans experience who are also extremely vulnerable to potential HIV acquisition, we want to make sure that those spaces, we wrap our arms around the people who need that, who need our support, who need to have loving, safe environments the most. So what is HIV stigma? It is a form of sexual stigma that refers to beliefs, attitudes, behaviors, judgments around people who have a higher chance of contracting HIV or people who already have it. And it's really rooted in some of the outdated information that we've had since the 80s and 90s when the epidemic first began. We, at that time, didn't quite know what to do with HIV. And so we didn't know what the people who were living with HIV quite needed. And even in our healthcare systems, there were stigmas, from nurses, from hospital staff, from people who were in their lives. And we continue to proliferate some of these myths about HIV even today. And so it is our jobs and our responsibility to make sure that we educate our communities as much as we can so that people have the right information about how HIV is or is not transmitted, the ways in which people who are living with HIV work to achieve an undetectable viral load, and how undetectable equals untransmittable, and that we have ways that we can prevent HIV that are inclusive of condoms, but not solely reliant on condoms. Additionally, the government created laws around HIV to stigmatize those individuals. And so these laws are still in effect in about 35 different states across the country. And these laws related to HIV are in stark contrast to other conditions such as Hep C, Hep B, or Hep B, which are also potentially transmitted sexually. And I encourage folks to go look at Pennsylvania, go look at the area that you live in particularly, and see what the laws are related to HIV criminalization. They vary broadly based on where you live, and some of them go as far as saying that people who are living with HIV cannot have sex. Some of them go as far to say, like having sex with people who are living with HIV it's that person's onus to disclose. And so I want you to know what the laws are in your area so that you have the most information that you can to arm yourselves with. And then lastly, despite major advancements in treatment, we still see high levels of stigma associated with people living with HIV. Back in the early 90s and the 80s, people were taking multiple medications, not just to treat HIV, but also to treat some of the side effects that came with HIV as well as with those medications. We've gotten to a place now in the epidemic where HIV treatment has become much more simple, much more manageable, and we can get people to undetectable much more swiftly. And as we all know, getting individuals to undetectable, making sure that they achieve that level of viral load and making sure that they are unable to transmit, it's kind of the gold standard. In addition to that, because I don't want to put the onus all on people who are living with HIV, for people who are HIV negative, it's important that those individuals do use the tools in their toolbox to ensure that they also remain negative. And so it's one of the things that people often don't think about. We know a lot about stigma related to people who are living with HIV, but there is a particular stigma related to PrEP, because again, we do stigmatize sex in general. And so PrEP stigma is a type of stigma that refers to negative attitudes and beliefs about people who take PrEP, right? It's kind of crazy to think that you would have a negative thought about somebody who's choosing to protect themselves, but we do, right? We think that those individuals who are taking PrEP medications may be a bit more sexually adventurous. They may have more partners. They may be engaged in what people think of as more risky sex. So we think that those people should change their attitudes or their behaviors around that, and we stigmatize them for it. Just so that we're clear on what PrEP means, it is the idea of taking a medication every day to prevent before being exposed to HIV in order to reduce the risk of contracting HIV. It's highly effective. We encourage people to use it in combination with condoms. However, I recognize the reality of how some folks like to have sex and what pleasure may mean to people. And PrEP may be a way for you to actualize sort of a more robust pleasure palette while also preventing yourself from contracting HIV. And the stigma is that people who are using PrEP, as I mentioned, may have riskier sex, they may have more partners. And so sometimes people who are taking PrEP medications will try to hide them. They may or may not talk to their partners about them. But we want to make sure that we encourage people to take it, right? It is a advancement in science that really has benefited the HIV epidemic. And when we think about populations, again, that are more impacted by the epidemic, so I'm talking about Black men, Black women, Latinx or Latina persons, persons of trans experience, people who are unstably housed, people who are substance users. It's really critical that we get those individuals PrEP rapidly so that they can continue to protect themselves as much as possible. So when we think about how stigma represents impacts underrepresented groups, in the United States, there are a number of different types of things people face discrimination for: gender, race, class, income, sexuality, education, culture. There are events in our country sometimes that happen that shift how we view certain cultures broadly. And some of these underrepresented groups are disproportionately impacted by HIV and other STIs. And as I mentioned, those individuals include Black and Latinx or Latina people, as well as queer individuals. And those people may take different mechanisms to cope with their stigma, right? People manage anything that's happening in their life differently. Some of us may smoke, some of us may drink, some of us may go have more partners, but we want to make sure that people can find social support in whatever it is that they do in an effort to lessen the negative impacts of stigma, right? And maybe you find that in church, maybe you don't. Church is not always the safest space. Maybe you find that in the house ballroom community, right? Where you sort of get a more chosen family of people who are more committed to wrapping their arms around you in that way. So we want to make sure that people are able to address and overcome stigma individually, interpersonally, organizationally, and institutionally, as well as on the community level, and most importantly, maybe on a public policy level. It's really critical that we remove the barriers that exist on a governmental or healthcare level perspective to really support individuals who are living with HIV, as well as those who are at risk for acquisition of HIV. So when we think about something to consider, we want people to, as we think about taking action against stigma, think about, do you feel safe speaking up, right? About some of the stigmatizing behaviors or discrimination you experience? Is the environment safe? you can put this into context of your own employment. Sometimes you see things happening against other people and you question, I know that this is wrong, but should I say something? And what are the ramifications of me saying something for both myself and the other person? How might it affect you? And do you feel nervous? Do you think you may risk losing your job or a raise? Do you feel like you may also be exposed yourself, or that something physical or verbal violence may be present? Some of the other considerations are to think about how you will speak up. In person is one way, but you can also do things much more anonymously, phone, letter, email. So when we see people being discriminated against for any of the things aforementioned, we want to make sure that we think about, how do I support that person, right? Because I don't want somebody to do that to me. Are there other people or other safe spaces who can join forces with you? And then if you encounter stigma in a healthcare setting, how do you feel talking about that with your healthcare provider? And if it doesn't go well, are you prepared to move to another provider? I always like to tell people, your healthcare provider, whether you're living with HIV or not, is one of the most important people in your life, and probably the most important person in your healthcare journey. And if that person is not supporting you, if that person is stigmatizing you in any way, shape, or form, and you're not able to get them over the hump of stigmatizing you, you should move to a different provider. You are paying that person for a service, and they should be giving you the red carpet treatment with all of their patients. That is easier said than done, because some of us live in areas that are less resource rich with providers. And if you do live in an area that's less resource rich with providers, maybe it's something to consider, to think about, how does telehealth work, or teleprep, or telemed? Am I able to get my needs met by someone who is maybe not in my location, that I can see virtually, if that's a possibility? There are also some steps that people can take to cope with internal stigma. We don't want people to create self-doubt and shame, but it does happen. Finding counselors and therapists are huge. I had not gone to therapy for a long time, and then found out that having a therapist is probably one of the best things that you can do for your own personal mental health journey, to learn more about yourself, about your reactions to things, and how do you create positive atmosphere and environment around you. We want people to seek support from family and friends, and stay engaged, right? Join support groups. There are a number of them that happen throughout the city. There are a number of digital support groups now that people can join. If you feel still some internal stigma around people in your immediate vicinity knowing about you, you can talk to somebody who is in Dubai, if that makes you feel more comfortable. And then always educate yourself and stay informed. The landscape of HIV prevention and treatment right now is changing really, really rapidly. Every couple of years, we're seeing new things being developed. We're seeing new ways of treating people, faster ways. We're seeing new ways to engage people in care. And so we want to make sure that you stay on top of the education that is available to you, as well as partially to make sure that you know what you need, but also so that you can diffuse stigma as it happens, right? So for people who have outdated information, you can be the conduit for education. And then externally, as I mentioned, we want to talk to people about it if we can, but we want to speak, or we want to correct myths, stereotypes, and false information that exists, particularly around sexual health and mental health, and use words that are affirming and supportive. And some of this language change doesn't happen overnight. It really has taken me personally a process to kind of get to a space where I try more actively to use person first language, where I'm thinking more intentionally about how the words that I say are going to be received by someone else. And so we want to make sure that as we talk about the behaviors people engage in, as we talk about people's lives, that we're using words that don't put them further into holes, or don't put them into holes at all, but really are more designed to uplift them, to help them and support them in whatever it is that they're going through. On an organizational level, stigma is found everywhere, as I mentioned, including in the healthcare setting, including at spaces that are designed to be for us and by us, right? So just because I am a Black queer man who creates a healthcare space for Black queer men doesn't necessarily mean that I'm not going to stigmatize Black queer men about those things, right? And so it's an interesting paradox where we create spaces for us, by us, and still discriminate against people who are coming to our services in those particular spaces. And so we want to make sure that when we educate the folks who are leading those spaces, right, as well as their staff, and we create places that are a bit more culturally humble. And part of removing stigma is ensuring that people understand the various cultures that people are enrobed in. And again, if you don't feel like it's safe, think through other actions for talking about stigma related to HIV or persons who are at risk for HIV in those areas, and think about how we can switch to different providers if that's something that someone wants to do. What can be done about the stigmatization of PrEP? This is a hard one. I would say chief among this that is maybe not on this slide is maybe to stop stigmatizing sex, right? Let's not stigmatize an act that many people need, that many people enjoy, that is beyond the benefit of a sort of heteronormative idea around conception. And so first of all, let's not stigmatize something that that many of us really all enjoy, and something that some people have to do for work. And so we want to make sure that we remove some of the outdated beliefs around PrEP, some of the things that came out when PrEP was first released in 2012, even in the literature at the time, a decade ago, didn't really reinforce PrEP as a great idea or engender people to want to go get it. Because again, as I mentioned, it was something that people thought that they would use and that they would go have more sex with more partners and do riskier activities. What we know now is that that was not necessarily true. If you were not using condoms prior to using PrEP, PrEP was not going to be the thing that made you not use condoms because you weren't doing it before. And so what's important in that is that we support people in their utilization of whatever prevention method that they want. We have to educate ourselves about the ways that people can take PrEP, the reasons why they may be taking PrEP, and then through our words and actions, support them in their ability to actually do this as a daily practice. And so as I begin to wrap this up, again, just to review, think of stigma as a mark of shame. It's something that we tell people that because you are this thing, you are somehow less deserving of other benefits that we give to other people. That can be related to your race. It can be related to who you choose to love. It can be related to how many limbs you do or don't have, right? There are stigmas across the board for any and everybody. Generally, they're rooted in outdated beliefs and lead to discrimination. And in some cases, again, for our persons of trans experience, this is extremely evident. It can lead to physical violence. And so again, we want to make sure that we remove some of these outdated beliefs, that we protect the people who most need protecting so that we can ensure that everybody has access to really high quality health outcomes. Stigma surrounding sex, HIV, and PrEP is particularly harmful. It prevents people from getting tested, from knowing their status, from taking medications that may help them get undetectable, or for taking medications that may help them to stay HIV negative. People feel that they may be insulted, rejected, gossiped about. We know how the community can be sometimes. The girls like to talk. And so we want to make sure that we somehow create spaces for people to take medications that help them feel empowered, but also don't reinforce negative attitudes or beliefs about themselves or others. And then lastly, when we see stigma, we want to make sure that we're able to talk openly when we can and when it's safe about matters of sexual health, including PrEP and HIV, and the importance of staying sexually healthy. Also staying pleasurably sexually healthy, right? I don't want us to leave this and not think about sex from a pleasure perspective. I think it's probably one of the most important things to talk about with sex, but that pleasure also comes with stigma. And so we wanna think about how do we talk openly about pleasure? How do we talk about the stigma that comes with sex, but also how do we remove all of those barriers? Here are lastly a couple different places that have some resources related to stigma. One is hiv.gov, the other is the CDC. Gilead also has our Let's Stop HIV, the CDC has Let's Stop HIV Together. And then Planned Parenthood also has a number of resources around stigma. For stigma, mental health and substance use, NAMI, or the National Alliance on Mental Health, is a great resource, and SAMHSA also has some great resources. Gilead also has a number of resources related to stigma and sexual health, as well as cultural humility. And I'm happy to offer those to individuals should you like us to be able to want to engage in a presentation or program around cultural humility. How do we create safer and more inclusive spaces for providers, for patients, for anybody who is living with and or affected potentially by HIV. And so with that, I'm going to take a pause. I'm going to turn it back over to Kat. Did that in 30 minutes. I like to make sure I give people a little bit of their day back because I know we're all busy through going on right now. So Kat, I will turn it to you.
Yes, I want to first say thank you so much for that wonderful presentation. It was incredible and amazing and full of so much helpful information, not only for our community, but also for us who work with folks from the community. So thank you.
Absolutely.
At this time, we don't have any questions. To the attendees, please feel free to put any questions that you have at this time in the Q&A box located at the bottom of the screen. Or if you have any comments you'd like to share with our panelists, please do so now.
And there's no bad question. I'm happy to answer any and everything related to this or to other things you may have seen come out, at least from Gilead in the past.
I had a question, going into COVID, I think one of the things we were really nervous about was going to be access to services for folks who were going to get stuck inside during quarantine and who needed access to services, to testing, to condoms. Post-COVID, have you all been doing a lot of work to kind of navigate continuing to work with folks who don't feel comfortable kind of leaving, coming out into the community, want to utilize telehealth?
We have. So Gilead has been sort of very proactive about trying to create or help agencies create protocols around telehealth or ensuring that people who don't necessarily have the ability or desire to go into a clinic in a post-COVID world, what is the way in which you still receive services? And so we do create with the sort of permission of executive staff at an agency, what's the process for this? What labs are you going to be using? Going to use LabCorp or Quest? Like, how do we make the patient journey really seamless for people who may have been lost to care in 2020, 2021 because of the pandemic, but can we create easier ways for them to get back into care that are sort of low threshold and not cumbersome for people? Yes,
that's wonderful. Can Blake share your contact info with the attendees?
I can provide my email address. I will put that in the chat right now. Let's see if I can type because my fingers are. So if you have questions or you want additional resources, we want to talk through some of the additional Gilead offerings, we're happy to engage in that conversation just so that people are aware. We do, as I mentioned, work with the creation of protocols for folks for health systems. We also have related to medications for treatment or prevention, samples of those medications. So when we think about things like a rapid initiation of a medication for people who are newly diagnosed with HIV or for persons who are looking for PrEP, right? Instead of making people come back and wait 7 days, 14 days, 3 months, how do we get someone in the office the same day with the thing that may help them?
Wonderful. Thank you so much.
Thank
you.
Any
more questions, anyone?
We're seeing none.
Not at this moment.
And again, if you don't want to ask it in front of the broader group, you can just feel free to email me. I'm happy to respond to questions there.
Yeah, that's such a good point, Blake. I notice sometimes it's easier for folks if you're presenting, maybe to write down their questions on a Post-it note and give it to the presenter at the end. It's one of our skills we like to use over here. Any more questions for Blake? All right, Blake, at this time, we don't have any more questions. I'd like to thank you again so much for your wonderful presentation. And thank you to all of our viewers for joining us today. Please join us for more of our upcoming presentations. And with that, I say thank you, take care, be safe and well, and have a wonderful day, everyone.
Take care.